Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to this week's podcast, the Knowledge Nugget edition. We are bringing you the latest hot topic that you have to have seen all over. We've gotten tons of requests, and it has been a floodgate in the telehealth business on Trump's $8.3 billion bill that was passed on Friday on the telehealth Medicare restrictions being lifted for the coronavirus. Everyone is going full court press and trying to figure out how to keep seniors at home and safe in lieu of coming in to ERs, clinics, and to offices. So what does that mean? As you know, there's been a lot of change, positive change for the telehealth industry in 2019, and Medicare Advantage and Part D adding significant codes that went into effect January of 2020. But what does that mean of the restrictions lifted? That means that if you are a practice, if you're a hospital, if you're a clinic, and you're serving senior patients, you're serving nursing homes, SNFs, any chronic care conditions, patients that might be at risk, oncology, things like that, you need to have a telehealth solution in place to be doing those appointments, those routine appointments to keep those folks safe and at home, and doing those appointments and follow-ups with a telehealth platform. We've seen a huge surge just in Friday to early this week of what's been going on in the industry. A lot of people that were putting telehealth in place that had plans for it, that this has really escalated their plan. There's a lot of cancellations on regular appointments that we're seeing in the industry, people not wanting to come into doctors' offices and be potentially exposed to patients that are sick. And so as you've seen the hysteria, kind of the panic that has been with everything canceled, here in Austin, HIMSS was canceled. We're not in Florida. So there's been a lot of things obviously canceled. South by Southwest here in Austin was canceled. And so there's creating a lot of that. In addition, people that don't want to go into the ER, urgent care, things like that, and just, trying to limit their exposure. So there's been a huge surge in consumer-facing telehealth. There's been a huge surge in telehealth in general of wanting to connect. Obviously, if you need to, if someone thinks that they have symptoms of the coronavirus, you're not going to be able to do those testing through telehealth, but doing symptoms through that and determining who needs to come in, who doesn't, looking at your appointment types that you have today, follow-ups. A lot of people have had surgeries that need to do post-surgical follow-ups that are high risk because of infection and wound care, things like that. So if you're a practice, a hospital, clinic, and that has been on your roadmap, now that those restrictions have been lifted, that's opened up the ability to reach those patients, keep them safe and at home. This also goes for pediatrics. So as we look at the most affected populations being younger as well as older, we've also seen a surge in pediatrics. Moms are not wanting to bring their children in to get wellness checks. If they're sick, taking them into urgent care, taking them in the ER, taking them into the pediatric office. So it's not just the restrictions that have been lifted on the Medicare side that you should be thinking about. You should be thinking about the telehealth side from the commercial payers, the Medicaid side that already existed, and how to service those patients. So if your business on the healthcare side is being affected, I know a lot of people are seeing big surges of people kind of from anxiety coming in and having symptoms from that perspective, but also normal patient interactions. You need to be thinking about how to, not cancel those appointments and see those cancellations to, since we're getting hit on the stock market and in other areas, really need to be thinking swiftly on how to implement that. So if you have any questions on what that means to your healthcare organization about those restrictions being lifted, what are the billable codes that are available today, we're always here to help. We've gotten a ton of questions, been answering a ton of that. From that perspective, as this is developing, we'll be doing more knowledge nuggets to provide that level of detail and keep you guys as updated as possible on as these things develop and we get more information on codes, as we get more information on what we're seeing in the industry. As we have our pulse, we're going to be sharing that on the Thursday edition. And so stay tuned. Make sure you subscribe to get your weekly podcast delivered to your podcast player of choice. Or as always, you can follow our YouTube or Vimeo channels to get the videos or follow us on social. So stay tuned. We'll be updating you on the telehealth restrictions waived. You've seen a lot of officials from the American Hospital Association, the American Telehealth Association, ARP, as well as Trump promoting telehealth. This has happened a little bit in the past, but nothing like we've ever seen before of the promotion of telehealth and the encouragement to the industry to use telehealth. It's been great being on the telehealth side of this and being able to help as many patients and practices and hospitals as possible. So stay tuned, stay informed, and we're always here to answer questions and help in any way that we can. We will stay tuned and see you next week. This concludes today's episode of Executive Innovation Show.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.